So we are going to be pushing that every girl child receive HPV vaccine, but the time has long passed for it to be transformed from a girl-child program to a child program, and so boys and girls.
That was advisor to the Minister of Health, Dr. Leslie Ramsamy, during a recent interview with Nightly News. Dr. Ramsamy underlined that in an attempt to address the low rate of the Human Papillomavirus vaccination and uptick of the visual inspection with acetic acid VIA testing in the fight against cervical cancer, health authorities will be intensifying efforts to immunize a target cohort of society.
The ministry, speaking on behalf of the ministry will be elevating the HPV vaccination program in terms of awareness, education, etc. So our communication strategy to promote the use of HPV vaccine will be ratcheted up.
Ghana introduced HPV vaccine to girls between the ages of 9 to 11 years old via a collaboration with the Education Ministry in 2012. The program was relaunched in 2016 after 100% vaccination coverage was not achieved as anticipated by the Ministry of Health. Earlier this year, Health Minister Dr. Frank Anthony had revealed that the uptake for HPV first dose vaccine was approximately 30%, while a mere 13% of girls had received both shots. This has resulted in a country being way behind achieving goals set by the World Health Organization for the elimination of cervical cancer. The World Health Organization on November 17, 2020, launched its global strategy to accelerate the elimination of cervical cancer. This strategy outlines that successful implementation of vaccination, screening, and treatment for the disease could reduce more than 40% of new cases and 5 million related deaths globally by 2050. The goals outline that 90% of girls fully vaccinated with the HPV vaccine by 15 years of age, 70% of women screened using a high-performance test by age 35 and again by 45, and 90% of women identified with cervical disease received treatment, 90% of women with pre-cancer treated, and 90% of women with invasive cancer managed. Temika Rodney reporting for the HGP Nightly News.